So by doing this slogan, and unfortunately the NHS have spend a lot of money to promote, but I don't think they have used it, properly, because still people here, they are not really coming in time, because time is brain cells. Do you know, in 1 minute, the brain lose more than up to 2 million cells. 2 million cells, we lose it if you have stroke. And stroke is due to either 85% of the stroke is due to clot. You have clot, which is causing obstruction or occlusion of blood supply to cells, and then you lose the function of that cells, and then in correspondence you will get the symptoms and signs. So first we have to identify that the brain, we have the right side and the left side. There are two parts, two called the cerebrum, and there's one part at the back called cerebellum. Okay, the right side control the left side, and the left side control the right side. So it's vice versa. And the posterior part, or the back part of the brain, that is important for our articulations, speech, as well as our balance. This is why we see when the babies, they get, when the brain complete the growth of the brain, the baby at 2 years, then start to walk and to walk better. This is why the balance is important, because by the completion of the growth of the back of the brain. So I think stroke, when it affects one part of the frontal part, the middle part of the brain, the posterior part, then it can cause this damage to the other side of the body. The problem is that, as we can see, we haven't really, you don't know about this slogan. Imagine how many of us, especially the ethnic minorities, even the well-spoken English people, the British people, white people, they are not really, still, they are deficient, they are still coming late. I had a patient who had posterior circulation stroke, who has been driving. He lost part of his vision on both sides, both eyes, half. He can see you half. And he was driving, because he didn't know that, because fast is deficient. Fast, they added B fast. They put balance, B for balance, and E for eye, because they know that if you lose or you get disturbance in your eye, you see double vision, or you lose part of your vision, that means that you have a stroke. This is why you have to come in time. And the time, the evidence has proved that we have to do it within 4.5 hours. So you have to come within 4.5 hours. It's important because if you come early, you get the treatment. We have to give injections, which is dissolve the clot, and then it will restore the blood supply, and then your brain cells, which is almost going to die, it will get fresh blood, and then it will survive. The other problem with the stroke, we have stroke due to bleeding, which that's the one which is more difficult, so that we cannot do much about it. But as well, if you come early, you can have what you call decompression. We send the patient to neurosurgeons, and they do decompression, so they relieve the pressure, and then you relieve the rest of the brain. So because the damage is already there, but you can make يعني البيشنت survivable. يعني patient can survive if you can يعني you have to save the other part of the brain. Therefore أنا يعني I have created something for Arabic speaking nations. First I started with Arabic speaking people. I did it for Arabic speaking countries because stroke is very common in our countries. Stroke is very common in our countries, and do you believe that we have 600,000 stroke cases per year in Arabic nations? 600,000 per year in Arabic nations. We have probably more, but just the registered one, the one who really normally come to hospitals, present to hospitals. Therefore, I created a word called تحرك. And you can see تحرك يعني we don't need to explain it because you can see it on the slide that is تحرك. It is more يعني informative and more comprehensive than fast. As I said, people يعني لما know English well and as well they didn't hear about fast. Therefore, I said if we can really create or give them the awareness by pass the message called تحرك, and even I put it in English as well تحرك, but it's تحرك in Arabic تا فقدان التوازن or loss of balance. Therefore, we have covered the posterior part of the brain, which is the stroke, which affects it. Because people sometimes they can wake up in the morning and they tell you, oh, I have got severe drowsiness or dizziness. I can't move. The room is just moving around. Therefore, this is a sign of stroke. Some people they say, oh, it's fine, I'm just really tired. I have to wait until, I get better. And some people they go to sleep. Unfortunately, they wake up with a big, massive stroke.